Hi everyone, and welcome to week 11 of the Nursing in Ontario course. This week we're going to look at more important concepts that will shape your nursing practice and provide the foundation for critical thinking, clinical reasoning, and overall judgment as you prioritise your patient care. This week we have 5 topics to examine. When you read through the various documents, try to imagine how they might apply to the clinical setting. Reading the related case scenarios that the CNO often includes is a good way to see the practical application of the standards and guidelines. Learn about restraints. Do you have any assumptions about them? There are only 3 types of restraints. Chemical restraints are psychoactive medications used with the intention of preventing particular behaviours or movement. Physical restraints restrict movement. Think about bed rails that we raise to prevent our patient from falling out of bed. I remember putting up the bed rails for safety whenever I left the patient's room. I didn't realise they are actually physical restraints. In this situation, patients must have a way to leave the bed should they wish. If the patient has not asked us to put the bed rails up, they are considered a restraint. Environmental restraints inhibit mobility. For example, a locked area prevents a patient leaving, and large objects blockading a door or a hallway, such as large plant pots, will obstruct a way out. You should understand the CNO's policy direction of least restraint. Know about the ethical implications of restraints, patient safety, the health issues and risks, and the legislation. Ensure you know the nurse's responsibilities related to restraints. The CNO Learning Module for Restraints is a comprehensive tool that covers the related standards and guidelines well. End-of-life care is an ever-evolving topic, as you know, and there's legislation being discussed related to assisted suicide in Canada. Although the CNO documents related to end-of-life issues are being updated, I have posted the standards and guidelines as they were to give you some understanding of the concepts that are considered important when caring for patients who are palliative. Please also read the documents from the Registered Nurses Association of Ontario, the Canadian Nurses Association, and the International Council of Nurses to get a broader perspective of end-of-life care. You should familiarise yourself with advance directives, living wills, power of attorney, CPR, palliative care, end-of-life care, and DNR. What are your assumptions about resuscitation? Be aware of the expectations of nurses, general expectations, identifying the client's resuscitation wishes, identifying the client's wishes overall, documenting and communicating the client's wishes, reviewing the client's wishes, implementing client's wishes, and pronouncing death versus certifying death. What are the ethical issues related to resuscitation, and who can assist with these? Medical directives are orders, and you are expected to know which healthcare professionals can legally write specific ones. You should know about directives, direct orders, and standing orders. Know when an order is required and what information a directive needs to include. Be aware of who should be involved in developing a directive and what policies are needed before directives are developed and used. Know what the responsibilities are of the physician who writes the directive and the healthcare professional who implements it. I don't like the word order, as it implies reduced accountability on the part of those following them. I see orders as prescriptions for medications, treatments, tests and therapies, and that helps me appreciate that I must refuse to follow them if I feel they are not appropriate for the patient or situation. And that leads us to the next topic: disagreeing with the plan of care. Nurses are self-regulated, which, as you know, means we are accountable to search out the right thing to do in any given situation. If we feel something has been missed or does not fit the situation, it is our responsibility to make that known and ensure we advocate for our patient. This is not always easy to do, but if you remember that this is done with our patient at the centre of care, it will help you to feel more confident in the process. You should know the nurse's responsibilities related to the implementation of plan of care, review the decision tree for disagreeing with the plan of care, understand the processes and implications of refusing assignments and also abandonment. Of course, there are very few people who enjoy conflict, and when we look at conflict management and prevention, we can start to understand where this might create a positive outcome. Learning about our own response to conflict, which is usually the avoidance method, can lend perspective to how we might improve our own approach in order to get to the outcomes that better serve our clients. Managing conflict situations well can help us learn as a team and become stronger. Preventing conflict in the first place may not always be the preferred option, but often communication is a big factor in prevention. You should be able to identify risk factors and strategies for dealing with conflict, as well as being able to distinguish between verbal and physical abuse. Learn about the protocol for recording and reporting conflict or abuse, and the importance of debriefing after a critical incident. The Week 3 online quiz will capture some of the things we discussed in the last class. I will go over the case scenarios assignment again and talk about the Week 11 activities, which are discussion board based. I included a slide to explain the unfolding case scenario, and lastly, I outlined the preparation for the Week 12 in-class session. As usual, you'll find the online quiz in assessments, and it will be available from Tuesday, May 24th at 10 a.m. Try the quiz as often as you like and check your marks in My Grades in the course menu. As you know, you can pick 2 of the 3 case scenarios attached in the assignment section. Remember that only 1 title page is required for both scenarios you choose, and you should be putting everything together into one document. Each case scenario needs 2 pages and a reference page. Using APA format means you'll be double spacing your work. If you submit a Word document instead of a PDF, I can make the comments directly on your assignment, and you can see where changes would have improved your mark. This round of case scenarios is due as an online submission. Please try to double check you're uploading the correct document before you hit submit. In the assignment instructions and for future courses that ask you to write about case scenarios, you can make things easier if you follow a plan. This slide and the instructions in the course gives a good guide of things that will help you to critically think through the relevant concepts for a concise answer. Remember to use the marking rubric as a guide to know what I'll be looking for. For this week, complete the online quiz I spoke about earlier, read the Week 11 documents that have been divided up into 5 topic folders, and complete the discussion board questions. If this is your first experience with an unfolding or progressive case scenario, I think you will enjoy the idea. If you have several separate case scenarios to work with, they can be detached and not as engaging. You may need to change your thought process several times. With an unfolding case, you are asked to follow your patient through a sequence of events that builds upon the previous situation. Expect to be engaged on a more intimate level with the story, as you can look back on a previous scenario and imagine your patient and caregivers as they evolve. I hope you enjoy this week's discussion board questions. They will be open for teams to begin work on Tuesday, May 24th at 10 a.m. As usual, the assigned team will complete their post by Friday at 11:59 p.m. and the next team will respond by Sunday at 11:59 p.m. I included this slide in case you wanted to set aside some time to get to know your campuses and the resources available to you. Student Services is a very friendly and accommodating department that helps students in numerous ways to be involved and be able to take advantage of all the services available at the college campuses. You have access to the library learning commons on-site and also from home, counselling services, study tips, help with writing essays, health issues, and knowing what the cafeteria hours are, etc. Next week, we'll be back in the classroom. As usual, there will be an online quiz based on the work you did the previous week. Reading ahead will include the process and importance of reflective practice. Your learning plan assignment is part of the CNO Quality Assurance Programme, but there is more to this programme, as you will find out. The CNO Complaints and Disciplines process deals with protection of the public by investigating issues. you should know more about this and the CNO's role in investigations and hearings. Thank you for watching. I hope you have a great week, and I look forward to working with you in class next week.